The next interview comes with a bit of a warning. It is a sensitive topic, and please be advised that it relates to loss during the COVID-19 pandemic and is certainly not suitable for children or for those that are grieving. So that's the warning up front. The Water Research Commission, in a continued effort to raise awareness on COVID-19, has put together a fact sheet that looks into death and burial at this time, including the health and environmental risks. Let's discuss this now with Research Manager at the Water Research Commission, Dr. Eunice Ubomba-Jaswa. Doctor, thanks for joining us. It's good to have you here on the program.
Thank you so much for having me.
I know this is a sensitive...
And like you said...
Yeah, as you said, you're about to say, it is. But
exactly. It is very sensitive.
If we get into it straight away, and I think one question that a lot of people may be asking, Water Research Commission, how is this involved in the situation when it comes to the burial of people who have succumbed to COVID-19?
Okay, so in terms of the Water Research Commission, we actually started this study because we wanted to ensure that water is protected from different types of land use activities. So when it comes to construction of your cemeteries and burial grounds, we have to take into consideration that if it's not done properly, it might have an effect on groundwater sources. And because South Africa is looking at groundwater as one of the mechanisms with which we are going to augment our supply, we have to ensure that it remains contaminant-free. So that's how the study actually started off. It started off from the environmental point of view to ensure that our cemeteries are safe, they do not contaminate our groundwater, and then obviously they don't have any health risks for people who subsequently use that water.
All right, so let's ask a couple of questions around this and how the procedure actually works. So when a person has died of coronavirus or coronavirus-related illnesses, we understand so far that a lot of these deaths have occurred within hospitals, and that's that's according to the research. How is the body actually taken care of?
Okay, so in terms of the death process, I think for the burial issue, where we come in as the WRC is mass burials. So like you rightly said, most people will die in a hospital, and the infection control procedures between death and subsequent burial are nicely outlined by the Department of Health and the National Institute of Communicable Diseases as to how to handle the body. So basically, it's about effective personal protective equipment. Where the environmental issues then come into place is when we have mass burial, because now we are being asked to prepare mass burial sites. And you want to ensure that if a whole group of people who died of an infectious disease are buried at one time, there wouldn't be any contamination that occurs from there. So I think in terms of safety from death to burial, that process has been nicely outlaid by government. And also by WHO.
Yeah. I mean, in many cultures, the bodies of the deceased are washed in very important rituals. How can people do this and still obey the sanitary requirements? Are they, in fact, allowed to do this?
So in our fact sheet, what we do recommend is that if death occurs at home, it's best that people who know how to take care of a dead body at that time are brought in. Because at home, you might not have the personal protective equipment that you need to ensure that you do not contaminate yourself. Because in as much as when a person dies, the microorganisms or the viruses also start dying immediately, you do have some infectious periods. So you want to ensure that whoever is dealing with the body at that time is not exposed. So it is a very difficult situation because, like you said, culturally, we do have different rituals and stuff that we do to send off our loved ones. But in order to protect ourselves, I think we have to step back and ensure that people who have the right equipment can deal with the body if we suspect that a loved one dies of coronavirus disease.
Have there been incidents whereby burials could not take place because that, this, of course, could pose a contamination risk?
Well, in terms of the different, let's say burial and cremation, because those are the two options that people go for. I haven't heard anything where burial has not been able to take place because the body has not been prepared properly. I think once the body is prepared properly, and then once this burial site or the crematorium is organized accordingly, bodies should then be able to be buried effectively. I think what I also want to point out is that crematoriums, mortuaries, burial grounds, the whole thing of safety in terms of cleaning, hand washing, personal protective equipment has to really emphasize at this time to ensure that just among people, coronavirus doesn't spread.
Yeah.
So it's really lovely to see masks being provided at burial grounds and people obeying the necessary social distancing that is needed so that they can celebrate the life of their loved ones without getting coronavirus in the process.
So, I mean, I know you spoke to this, but a little bit more detail on this. I mean, at present, how safe are cemeteries and crematoriums? As we know, the law stands that there is a limit of 50 people, but many of these chapels and sites are actually very, very small, and thus social distancing may not always take precedence because so many people are coming into one very small space with the deceased. Talk to us about this kind of situation.
Yeah, so definitely, like you rightly said, it's really on the onus of the undertakers, those who are organizing the funeral, to ensure that if your environment can't support the necessary social distancing you need to do for the 50 people that are required to be at a funeral, then there might be other mechanisms where you would have to reduce the number of people who are at the funeral grounds. I know that South Africa is not the only country that faces this type of issue. There have been incidences where loved ones have had to watch their dead being buried through Zoom and other very sort of mechanisms that are not the best.
Yeah.
But I think the key thing is to ensure that people are not getting coronavirus disease during that time. But for South Africans' history, in terms of burial grounds, we have a good history because we do have been doing that research work, even though it's a very sensitive subject. So we do know that if municipalities are being told to prepare burial grounds, they do have the necessary information as to site and construct cemeteries properly.
Yeah, you know, it is a very serious issue because I mean we've heard of cases where just from one funeral the amount of individuals that were affected because of it, and this is something that needs to be taken very seriously. One or two more questions to you before I let you go.
Sure.
The issue that people grapple with is of not being allowed to touch the body of a person who has succumbed to COVID-19. Is it true? Can you not touch that body?
Well, for me, for my background is actually medical microbiology, and I would say that we do not have enough information right now to say that somebody can touch a body immediately after somebody has died, because we don't know how long the virus lasts in the body. But based on other infectious diseases such as Ebola virus, where there have been huge deaths associated with that, the WHO does recommend that you have minimum sort of activities with the body, to ensure that spread doesn't occur. So definitely it is a difficult situation in terms of not having that communication with the body and saying goodbye. But I think it's something that we have to grapple as a society, and other countries that have experienced viruses like Ebola, for instance, might now be more accustomed to such practices. But we as South Africans need to now start getting there when it comes to this disease. Over time, when there's more knowledge about how long the virus takes to die off in a body between death and burial, then there could be more recommendations as to when people can actually touch the body or not.
Yeah.
But for now, it's best to not do that.
Yeah. Just a final question. I remember it was I think it was in April sometime last month, there were talks about, and you began by speaking about this, mass burials and mass graves. There was a time where South African municipalities had actually been asked to prepare for a position that we may find ourselves in. At the moment, obviously, we're sitting with a death rate of today's figure, I think 238, but you have countries like America that have got in excess of 80,000 deaths that have occurred from coronavirus. And as South Africa opens up, we hope we'd never get to a situation like that we lose those quantities. But we never know. And this is what we keep on being warned about. What about mass burials? What do we do? I mean, is this something that you're looking into, and are we prepared for this?
So I think that's where actually the fact sheet comes from, because of that requirement for municipalities to prepare for burials. And it's actually fortunate that we conducted this study in 2018. So we do have in the reports set guidelines that municipalities can follow if they have to construct cemeteries specifically for mass burials. And the South African Cemeteries Association also has outlined nicely in their guidelines exactly how they intend to prepare mass burial sites as well. So South Africa, we at least have that hindsight to prepare on time to ensure that it's done properly, so that our groundwater is not contaminated, people are safe, and we have supply of water for the future.
All right, we'll leave it there. Dr. Eunice, thanks so much for talking to us. I know it's not an easy topic, but Dr. Eunice is a research manager at the Water Research Commission. Eunice Ubomba-Jaswa talking to us about the Commission's fact sheet to raise awareness of what can and cannot be done with those who have passed away from COVID-19 related illness.